Dariyanani, founder and CEO of Cognotion. Jonathan, come on up.
Hey.
Jonathan, great to have you, and I'm excited to learn more about Cognotion, the work that you're doing in the elder care space. So just to kick us off, why don't you just give us a bird's eye view, what's Cognotion working on?
So Cognotion works on allied health training, specifically in elder care, but we do all sorts of allied health credentials.
Allied health training, break that down, industry term.
Sure, so 15 million people work in healthcare. There's about 1 million doctors, 2 million nurses. The other 12 million people are allied health professionals. Okay. So they're everybody who's not a doctor or a nurse, basically.
Okay.
Everything from, an insurance billing clerk to an orderly in the hospital, to a CNA, to a medical assistant, to a dental assistant.
All right, so your big health moonshot is to improve how those professionals are trained?
Yeah, well, and it's really actually more, I think, impactful than that in the sense of you can have this amazing clinical work, the best interventions, the best heart transplant procedures, the best trained physicians and nurses, but your intervention fails because an allied health professional fails to give that person the medication they need, fails to follow up on wound care, fails to give proper discharge instruction. And so it's like the last mile problem in healthcare. You can have the best clinicians in the world, if the 13 million allied health professionals aren't well trained, it fails. The system fails.
Okay, all right, so that's the problem. What's the solution?
Well, it's better training, and it's better training delivered in a better way. So right now, almost all of the intellectual heft and money goes to training nurses and doctors. Okay? You've never heard of any high prestige school doing an allied health program because it doesn't exist. In fact, even nursing is oftentimes not undertaken by the best people in clinical medicine. Stanford doesn't have a nursing school. Harvard doesn't have a nursing school. Yale has a nursing school, which is probably regarded as the best. But in allied health, there's nothing. There's not top researchers working on it. There's not top academics working on it. So we assembled best of breed, Stanford Medical School, NYU School of Nursing, and really upped the engagement level. Plus, we made it into the way that HBO or Netflix would have done training.
Oh, interesting.
That's what we do. So it's very story and cinema based.
Okay, break that down for me. How do you incorporate cinema into training?
Well, if you think about it, how, in medical school, they teach with the case method. So they'll introduce you to a patient, they'll go over their story, you see the family member. No one trains allied health professionals that way, but that's what we do. So you'll follow 7 characters, their conditions. Do they have dementia? Are they subject to elder abuse? Do they have COPD? Do they have diabetes? Do they have metabolic syndrome? And you'll follow them and see what happens with their families, why the procedures matter and impact people's real lives. And that's a much better way to learn than just reading a textbook.
So Cognotion has literally created shows that help allied professionals who are going to go into elder care specifically understand the patient population better, gain empathy, is that right?
So we built a 60-hour, fully state certified, there's 50 different versions of the course, licensing product that gets you through, let's say, the CNA license exam, but it's done through story. So the 60 hours have the stories embedded, and they also have the content and the exams and the quizzes and the simulations, but they're all grounded in this story.
Are they woven through the narrative?
Yes.
Very interesting. I've seen one of these, and the production quality is very high.
Yeah, so the person that shoots The Blacklist on NBC shoots our show in the off-season.
Okay, interesting.
So we really made a commitment to having, best-in-class cinema.
Okay, we only have a second, but what are you most excited about for 2020 for Cognotion?
Well, I think in 2020, I hope that we get 10,000 people who move from minimum wage jobs and low-skill jobs into their first ladder on a middle-class lifestyle by being able to provide great care to seniors and improving care in the field. So that's our goal, is to have 10,000 students certified by Cognotion by the end of 2020.
I love what you're doing. I love that you're solving 2 problems at once in terms of bringing dignity both to the worker and to the person in the elder care facility, and solving 2 problems at once. So keep up the great work. Thanks for coming down to the studio and sharing a little bit about Cognotion. Thanks, Jonathan.